Oregon Health and Science University presents a resource for health science educators. Profiles of health science professionals with disabilities. Nurses with hidden disabilities. Stephen Patton, RN, BSN. Mr. Patton has been a practicing nurse for over 20 years. He graduated from Mount Hood Community College in Gresham, Oregon in 1980. Before completing his degree in nursing, Mr. Patton was an EMT, medic, and LPN in the Army. He has been working at the Portland Veterans Administration Hospital in Oregon as a surgical nurse since 1996. He also worked for 16 years as a nurse doing tissue banking. Mr. Patton experiences a learning disability that affects him in the areas of reading and writing. Pam Rathbone, MSN, WHC, NP. Ms. Rathbone is a women's health nurse practitioner. She currently works in private practice with several physicians that practice conventional and alternative medicine in Portland, Oregon. Ms. Rathbone graduated from Boise State University in Idaho with her BSN in 1992 and with her MSN from Oregon Health and Science University in Portland in 1994. Ms. Rathbone experiences attention deficit hyperactivity disorder. This affects her ability to organize, manage, and process information.
My second year in college, got into a class that was had the first blue book test that I had to take. All the rest have been multiple guess questions for me, and I could get through those pretty easily, but to sit down and have to write an exam petrified me. And I tried to write it so that I didn't misspell any words, which meant that I brought my vocabulary and my sentence structure down to about third grade level. Still misspelled words. Turned it in, and the next time the class met, the instructor said, "Can I talk to you after class?" He said, "Something's wrong. Come with me, and we need to check something out," and took me over to another building at Oregon State and hooked me up with some people, and they said, "We're going to do some testing. I need to see what's wrong here." Did some tests, did some IQ tests that I did verbally as opposed to reading, did some other reading tests and writing tests, and they came back and said, "You're dyslexic, you have a disability. However, the good news is your IQ is very high. You're in the genius level." And I went, "Wow, that's really neat." I was really pumped up and excited about it. Went back to the class, and that was all they did. Nothing else happened.
I've been diagnosed with attention deficit hyperactivity disorder, and that is a disorder that is listed as a learning disability. The name of the disorder, attention deficit, is a misnomer because it really isn't an attention deficit. It's hyperattentiveness. Now, I can sit here and be carrying on a conversation, and I'm listening to the person that's walking upstairs, up overhead, and I'm hearing the conversation that's going on out at the front desk, and the person that's chuckling out in the hall, and the car that's, going back and forth out front. And it's a hyper attentiveness to absolutely everything that's going on in the environment. It's an inability to block out all the extraneous stimulus that's going on around us and focus in on one thing.
I went back to school to become an RN and was at a community college, and we had to do what's called care plans. And care plans are basically talking about your patients, taking a nursing diagnosis, either a real one or a potential one, and then listing how that related to your particular patient, what sort of interventions you were going to do, how you were going to evaluate those interventions, and then look back at your evaluation to see whether they're met or not, and then change your plan of care again. So it was a pretty elaborate, and these care plans could sometimes run 25, 30 pages typed. typed. So they were very, very elaborate care plans that we had to turn in on a regular basis. And basically I would get the information, work from a few notes, and dictate to my wife, and it worked out very, very well. However, one time one of our instructors said, well, now that we've done this, I want you to everybody sit down and do a care plan right now in class. And I, again, was petrified. This is my blue book exam all over again to me. So I sat down, I wrote it out again, trying to take it down a notch so that my vocabulary was words that I could spell, which makes me, even now when I look back at it, I sound even stupider because now I'm writing at 3rd grade level and misspelling 3rd grade words. But did that and turned it in. She called me into her office a couple days later and said, hey, who wrote those other care plans for you? And I said, I wrote them. She goes, no, you wrote this is in your handwriting, it's crap. These others are excellent, you got A's on all of them. Who wrote these care plans for you? Who did the work for you? I said, I did it. I said, she had about 6 or 7 of the care plans there in her office. I said, pull out any one, tell me the patient name, and start a sentence in anywhere of those 30 pages, I'll be able to finish it for you. Because when I have to write something down, even if I'm not going to write it myself, but going to dictate it to my wife, I painstakingly go through it in my mind over and over and over again, and so it basically flows out. So if you started a sentence in one of my papers, I could probably finish it for you even a year or 2 later. So I was able to finish sentences for her in all the different care plans, and she kept going and going and going, with 8 or 10 attempts to try to trip me up. And then said, what's wrong? I said, well, I have this learning disability. To get through college, I used a variety of different things that helped me get through basically the didactic courses that I had to sit and listen and take tests at. I also would never take notes in class, because if I tried to concentrate enough to take a note, I would be 10 miles behind. So if I sat down to write notes, I'd be lost by the time I came back up, because it'd take me so long to try to concentrate to write a few words down. So I just listened very intently. Would never bring a dictionary in with me. I'd bring textbooks, so if I have to look up a word, I would find it by chapter as opposed to a dictionary. Dictionaries didn't help me out to learn how to spell a word. Where I used dictionaries were if I was reading in a textbook and I couldn't pronounce the word, I could look up in a dictionary, find the definition, and then I'd say, oh, that's what that word is, and I'd be able to then pronounce it. So I would find by definition, because my vocabulary is pretty big, oh, this is the definition of the word, this must be, voluminous. And I couldn't read the voluminous there, but I could look at the definition, large volume, oh, that's voluminous, okay, good. And then I could go, I mean, I was concerned and embarrassed and didn't disclose because I didn't want it to be found out. So I mean, I wasn't blind, so I didn't have to disclose. I mean, and I didn't have something that somebody could physically look at me and say, you're in a wheelchair. I could try to hide what I did because I was concerned that I wouldn't meet the standard.
When I went back to graduate school, I didn't disclose my ADHD until I had been accepted into the program. And when I was accepted into the program, it was on probation because my GRE scores were exceptionally low. And they had only accepted me because I was the #1 applicant by my total packet. And my advisor had told me early on in the program that she didn't think I was going to make it because of a number of issues. And I felt like she told me I wasn't going to make it because of my ADHD, and she was watching me like a hawk. And fortunately, I had found a mentor who was a faculty person in one of the other specialties. But an interesting point was that I did graduate, and I did graduate cum laude, and I did graduate Student of the Year from the Nursing Honor Society. Well, for me, coursework or studying was the most difficult. The theory part, clinical was always the easier part, so coursework was difficult. Reading was difficult. Listening to lectures was easier. So taking notes was the important part. I could take notes really well, so I had to focus on that and study from the notes that I had taken. In studying for a test, I rarely would read chapter after chapter after chapter. And to this day, I don't sit and just read. I doubt that many ADHD people do that. I mean, it's just sitting and just reading I'd never have done that. If I have materials that I have to read, I will read the abstract, and then I will read the first sentence of each paragraph. I'll read the objectives, and then I'll read the results and the conclusion. I learned that a long time ago, and it has suited me very well. I read the things that, especially in research, I read the graphs. I will always look at the conclusions, the abstracts and the conclusions. Research is much easier to read than anything that's anecdotal.
I chose the operating room as a place to work is the way that we document. Out on the floor we have to do a whole bunch of handwritten notes dealing with the different care plans, the different things that we've done to take care of the patient. What we do here in the operating room is what we call the yes-no sheet. Basically, we have our nursing care plan document on the side, and we say what we did in relationship to that care plan. So it's much easier. I don't do a lot of writing. If I do have to do any writing, it's basically fill in the blank a word or two. Sloppy handwriting, looking at the chart, I can basically get the stuff communicated pretty easily. We have a computer system here that's basically a 5-page documentation that has prompts for us, such as who's a surgeon, who's the circulators, who's in the room, so we can document all those things. That's pretty easy because many times on the surgical schedule, all the names of those people are there. I don't have to worry about it. We also have a list in the room that gives me all the surgeons and all the nurses that I can pull up, so I don't have to worry about misspelling or not being able to get it. When I document positioning aids, all I have to do is enter different positioning aids I can look at by either doing question mark, pulling up an entire list of positioning aids, and just return through till I find what I need, which is a whole entire list, or I can just put the first few letters of the positioning aids, such as T for terry towel. So with positioning aids, with drugs, with all sorts of things that have multiple things that we've pre-stuffed into the program, I don't have to worry about how to spell any of those things because I can just give a first letter and it pops it up for me. I do a lot of hands-on things, a lot of technical things. I have to know what different types of surgeries are being performed. I have to know what the case is going to be for me to be able to prepare for the case. But basically we've picked all the instrumentation that we need to have for the case. We come up, we open them up in a sterile fashion. I wash my hands, gown and glove, and get ready for the case to proceed. I then also assist in gowning and gloving the surgeons, getting the instrumentation up and ready for the case, handing instrumentations, holding retractions, cutting suture, sometimes suturing as well. So there's a variety of different types of things that I do in the scrub position that does not require me to be able to either read or write.
I am an ADHD nurse practitioner. Where it comes at a disadvantage is the hyperattentiveness. And so I surround myself with people that are obsessive compulsive about organizing paperwork. And I've done that from day one, from graduation. And Amy, my medical assistant, is very obsessive compulsive about paperwork. When I interview my medical assistants, I say to them, I'm ADHD and I don't organize paperwork at all. My medical assistant is very obsessive compulsive about paperwork. And she will come and get me and say, okay, the stack's getting too high, and we'll go through the charts one by one. Okay, so this one's good.
Notified her already.
I walk into the patient room and say, how are you? And sometimes it's really difficult because I run over. And that's that sometimes for me is a real problem. But it was really interesting the other day because the receptionist was talking to a patient on the phone, and she was telling a patient, well, now, you know, this is a 15-minute slot, but you know, Pam can never, she can't even say hi in 15 minutes. And the patient said, yeah, that's what I like about her. And that was really nice to hear, because, you know, I always feel bad when I run over. But I walk into the room and I am really aware of everything that's going on in the room. I am aware of all of the nonverbal that's going on with the patient. It's something that I'm not really aware of. It's just part of who I am. Safety issues are absolutely valid issues, but patient safety issues are valid issues for every single individual that practices patient care, not just for individuals that have learning disabilities. And I have ADHD. And I challenge you to find any patient safety issue that I've ever had. I had a physician say to me once, it's not if you ever perforate a uterus putting in an IUD, it's when. Well, I'm a patient, I'm an IUD insertion instructor. I've never perforated a uterus. I worked 10 years in hospital nursing. I never, ever had a medication error, ever. ADHD individuals are aware that they need to pay close attention. So to generically classify us as high risk is absolutely unfair and uncalled for. I have chosen to look at ADHD positively, and I look at it with the view and truly believe that it offers benefits. It does cause some alterations in the way that I need to do some of the things that I do, but it also offers some benefit. I utilize some of the things that I have learned from ADHD. ADHD allows me to look at life from a different perspective. I am more creative, I think, than a lot of people. One of the articles that I read said, it was written by somebody that was ADHD, said that ADHD, those that aren't ADHD are congenitally boring. Well, you know, so at least I'm not congenitally boring.
Now that I've disclosed and told people that I'm dyslexic and that I have a very difficult time with reading and writing. I think probably 50 to 70% of them won't comprehend what that means. They'll think I'm a bad speller, and they have no idea that I just can't. And it's not that I didn't study hard enough in spelling, that I you know, it's not that I'm just a poor speller, it's that I can't spell.
Faculty or teachers can help. They can help. I could have been helped. One-on-one, if it's ever possible, I would seek out one-on-one by going in after class and getting, you know, asking, okay, I don't understand this. How do you do this? Show me a different way to do this. You know, I'm just not understanding it. And then, you know, the faculty would go about it a different way. I mean, just because a student doesn't understand the way it's presented one way doesn't mean they can't understand it. And there are faculty out there are teachers out there that will say, okay, well, let's look at it this way. I mean, there are just different learning styles. And, you know, some teachers are great at that. So whether it's flashcards, whether it's just quizzing each other back and forth, it's the social, it's the accountability, it's the verbal, using verbal, tactile, visual, using all the different types of learning styles, not just one, not just somebody standing up there lecturing.
My advice to faculty about how to deal with people like me, basically that's the only one I think I can talk to, is once you find out that a person has a learning disability, don't just let it go. Twice for me, people said, you have this learning disability, okay, it's great, I understand now, boom, and they dropped it. Say, okay, this is something that we can deal with. You have this disability, how can we do something that'll make it work for you? It would bother me if somebody said, how can we make it easier for you? Because I don't want anything made easier for me. I just want to be able to do what everybody else does and not have it be 1,000 times harder than everybody else. So work with me on making it so that I can compete on a level playing field with people. I think to include nurses in the field of nursing that have different disabilities, including learning disabilities like mine, is to embrace that. I think, again, as I stated earlier, people that have learning disabilities have had different experiences in nursing school than people that don't have learning disabilities. We went through the same thing, sat through the same classes, but I experienced it differently than you did. So embrace that, see what you can learn from me, see what I can learn from you.
The standards are changing and our needs are changing, and we need to re-look at the providers we're putting out there. We have new needs that must be met, and we have such tremendous need that's out there. If we have people that want to be nurse practitioners or nurses or doctors and are being turned away, we must look at why they're being turned away. And if it's a disability and they are capable of providing safe care, then this is a really poor standard if we're turning them away because we don't understand their disability or we're fearful of it.
Good, good.
People with disabilities do bring certain things to health sciences. I myself, I'm a great person, so I bring a lot with me when I come to my job. But I also bring the ability of how I think out of the box, and I think that many people, especially in medicine and in nursing can get very conservative in their mindset, and people with disabilities cannot be conservative because we had to do things differently, and so we think out of the box. So I think that's something that's very helpful. I think most people with disabilities know what their disabilities are, and I think that we know better than anybody else what our limitations are. I think that a person going through medical school that's blind, and you say, well, we can't let him go to medical school, he might be a brain surgeon. Well, I don't think he'd do that. I think that he would pick something that doesn't take his sight to do the job. Just like I chose an area that had the least impact on me as a nurse working in the operating room because I couldn't spell and couldn't write and had some difficulty reading. I don't work in an area that requires a high level of that. I can still do it. I got through school and did those things, but I chose what was probably best for me. And I think most people want to be comfortable in their job. They don't want to go and do something that makes them uncomfortable. So I think that people shouldn't be concerned that if they get through the program that they're going to pick something that they're going to do harm with. Most people that enter healthcare nowadays aren't doing it for the bucks. They're doing it because they want to help people, and they're doing it because they think it's the right thing to do, and they're not going to do the wrong thing.
Health Sciences Faculty Education Project, a resource for health science educators. Project staff, Project Director Joanne Sowers, PhD. Project Coordinator Martha R. Smith. Dissemination Coordinator Lisa Ferris, M.Ed. Project Administrative Assistant Tina Campbell. Additional support provided by Clark Hochstetler, M.A. Narrator Z. Boone. For project information, please contact Martha R. Smith, Center on Self-Determination, Oregon Health and Science University, 3608 Southeast Powell Boulevard, Portland, Oregon, 97202. Telephone 503-232-9154, extension 131. Email smitmart@ohsu.edu. These videotapes were partially supported by grant PR/3P333A900-51 from the Department of Education, Office of Post-Secondary Education. Copyright 2002 by Joanne Sowers and Martha R. Smith. All rights reserved. No part of this material may be reproduced, stored in a retrieval system, or transmitted in any form or by any means without prior consent of the copyright owners. Oregon Health and Science University presents a resource for health science educators. Profiles of health science professionals with disabilities. Nurses with physical disabilities. Candy